Good morning. Thank you so much for joining us. My name is Drarian Jones. I am the Digital and Development Specialist at Care Partners. We're so glad that you're able to join us, and I am so excited about our topic today. Today, we're going to be talking about the signs and different things to look for in your loved one if you're noticing changes or things like that, and how to tell if your loved one has dementia. So I'm super excited about our guest. Gina Galletti is here. She's the owner of Dementia Untangled Consulting Services, and she is going to tell us all about how to tell if your loved one has dementia. So we'll get into that in just a few minutes. Real quick, I just wanted to say thank you all for joining us one more time. And we are continuing to monitor this coronavirus situation. We are slowly but surely reopening some of our programs. We are so excited to get back to our in-person traditional programming. Very slow right now. We have just a few select programs restarting. So you can find all that information and more on our website, carepartnerstexas.org. If you have any specific questions as well, you can always give us a call or call your specific assigned coordinator. Our office number is 713-682-5995. And you can always email us as well. We'd love to hear what you're up to. Just stay connected with you. And if you have any questions, concerns, comments, or you just want to share a picture with us, you can email us at info@carepartnerstexas.org, and we would love to hear from you. I think with that, we're going to go ahead and get started with our topic today. I'm going to bring up our guest. Hello, Gina. How are you doing this morning?
I'm good, Darian. How are you doing?
I'm great. Thank you so much for being here. Like I said, I'm really excited about the topic, and I think it's a really interesting one. But before we get into the topic, do you want to tell us a little bit about yourself and what you do?
Yes. I'm a nurse. I've been a nurse for almost 11 years, probably at the end of this month. Most of that time was spent with skilled or assisted living memory care. I did work for behavioral health, which kind of, they're very similar in your interaction with them. My family and I have been in Texas for a little over 3 years. And I have a love for the population of dementia. I love teaching people and trying to educate them on how to manage their loved one with dementia. So I just kind of came up with an idea to now also, like, I work in a facility, and I know that I have family members that wish that they could keep their family member home longer. But often they don't have the skill set to do so. They may not have the understanding of how to manage the loved one at home. So I thought, well, maybe I could do that. I could go into the home, give them tips and kind of observe what's happening within the environment and see if I could offer them ideas that they could use with their loved one and possibly keep them home longer, which I know is many times the desire. Managed care is expensive. It gets, the price goes up all the time. It's not the same as a home environment. So if I'm able to keep a loved one home longer, that's my goal. So that's why I decided to try this business.
That is so great to hear. And I love to hear about all your passion and your care for this community. So just thank you again one more time for being here. And I'm going to let you take it away, and we'll get into the topic.
Okay. Well, one thing, when you have a loved one, you see them every day. And maybe if you have a loved one that you may not see every day, if you're a child, you could, say you're going to visit and something seems off. You have to ask yourself, is this a sudden change? Is this something that we've been noticing, progress as time goes on? You could enter your loved one's home and say, my mom used to keep her home very clean. Now we've noticed a lot of disarray. Maybe, that the bed's not made, and my mother would always make her bed before she, after she got up in the morning. Or my mother would never leave dirty dishes, but now there's dishes strewn all over. These are things that are not normal. How about their memory issues? Now, I kind of joke around that I have a terrible memory. So if the time ever comes where my children are one, they're going to be like, they're going to completely miss that because I have a terrible memory. But if your loved one normally does have a great memory, and all of a sudden they're forgetting more and more things. If you've been out to, say, a store, and all of a sudden they don't really remember where they are. If they maybe have called you and said that they were driving alone and got lost. These are things that are not normal. These are things that, and either yourself, if there's a spouse in the home, maybe is noticing things are off. And it can be concerning. There's some things that are maybe common age related. Like if I forget your name, but then, you say it, oh yeah, it comes right back. Those are age related issues, and those are not necessarily a sign of dementia. But if you have, say, like, and I used this example the other day, if your loved one has their car keys and all of a sudden they don't even know what these are, or they don't even know what to use them for, that's a red flag. That is not a normal aging related symptom that you're seeing. So then you have to think, well, what do we do now? We're noticing things in our spouse, loved one, parent. How do we now handle it? So one of the first things you should do is you absolutely should take them to see their primary care physician. What they should be doing first is doing lab work. They'll generally check thyroid issues. They'll see if there's any vitamin deficiencies, because some of these actually can present with dementia-related symptoms that if they're found and rectified, then the symptoms go back, or the symptoms go away. Also, if your loved one is on a new medication, that's one of the first things that when you're seeing a new medication brought in, you should be watching for changes. So your primary care physician should be made aware of what's happening, and then they can progress from there. So something as simple as checking urine. I mean, urinary tract infections in elderly can cause extreme confusion, behaviors that are not the norm. And again, that's something, if once that is checked, that could easily be fixed with an antibiotic, and then you'll realize, oh, my loved one is back to normal. So that's always good when you can find something, if you can find it, and have something to rule out. Now, if all of the lab work and urinalysis comes back normal, then you have to start saying, okay, we have to dig deeper. And there are tests that the doctors can perform, many mental exams. Some tests they'll have them pick 3 words. The doctor will say 3 words and then maybe continue on with the conversation and then go, oh, by the way, what were those 3 words that I asked you to remember? Some will have you draw a clock, and they would have they may or may not even have the circle of the clock, and they will ask you to put the numbers in order for the 12 hours. Now, again, these are basic tests. These are tests that the doctors can say, well, we can assume that it's dementia, because dementia can only be definitively diagnosed with an autopsy. So in the mild stages, you may have your doctor say, well, they have signs and symptoms of dementia, but they don't always give, especially in your mild form, you won't always get a definite diagnosis of dementia. I know that I've spoken with people and they're like, well, my mom has dementia, but, she's not experiencing much of any, no real behaviors, no, exit seeking and stuff like that. And a lot of that's why sometimes family members may be in denial about their loved one having dementia, because, in the mild stages, it can be kind of ambiguous. It's like, well, I can't really tell if something's different. Something may be different. But it's, I think that especially if you have different people in the circle of your loved one, they may be noticing things. And again, if it's your mom or your dad, or sometimes even your spouse, it's sometimes harder to admit that your loved one might be facing this diagnosis, because it is fatal. It will not get better. In the 70 years since the diagnosis, the term actually came into be, there's had no real progress in finding out why the plaque entangles are on the brain. It is degenerative. It is fatal, unfortunately, at this point. So, it's not always easy to face that future of, seeing your loved one and what their future will be if they get, this diagnosis. Now, the problem with sometimes some of the diagnostics is that the loved one might be hesitant about going to the doctor and maybe, having somebody tell them, I think you may have dementia. I know for myself, I think it would be difficult, because who wants to hear that you have a terminal illness? It's not easy to hear those type of things. So what I have suggested to different families I've worked with is maybe you can kind of circumvent that, and maybe call ahead of time and tell the office manager, the nurse, whoever you're speaking with, hey, I think my loved one has dementia, but I don't think that we've tried talking to them. They don't really feel that they have it. They may be in denial. So maybe, if you can tell the doctor ahead of time that this is our concerns, maybe they can gently approach it, and maybe in a way that that it might not be so traumatic. And I know that this generation right now, they definitely, if the doctor says anything, if the doctor said, jump off a bridge practically, they would do it, because they were raised that no matter what the doctor says, they're correct. So it may be better coming from them. So it's just a matter of getting them into the office, start, like I said, at least with the diagnostics, see what you can rule out if possible, and then go from there. So if it, and then the thing is that you do have to come to the realization, say everything is done. The doctor says, well, I think, we can say, not with certainty again, because that can't be diagnosed without an autopsy, that your loved one has most likely a mild stage of dementia. For myself, I would say, try to educate yourself. I've taken care of many loved ones in facilities where the children, a lot of them are very educated, but they've never taken the time to understand what's happening, that, it's actual brain damage. So even though they don't know why, what's happening is there's a buildup of plaque in the brain. And what it does is it kind of attaches to the neurons, and they get tangled. So if a neuron, which obviously is how the information goes across the brain, can't get through, well, then you're going to have these symptoms that you'll see depending on where in the brain this plaque is building up. And I've taken care of a lot of people, and their family member will say, well, I don't understand why, make my mother sit and eat. And I'm like, well, really the goal is not to have your mother sit and eat. The goal is, can your mom eat? And that's the most important thing. So we start to educate them on the new normal. There is a new normal when it comes to dementia, and we try to educate the families on that. Alzheimer's.org is a great resource. It helps to explain what's happening to your loved one, how it's going to progress. It's always good to find resources, but we'll talk about that in a second. Now, again, when you have a mild onset, you may not notice a lot of changes right away. You may see the symptoms progress slowly. Now, there's no way of knowing. I've taken care of a lot of people with dementia throughout the years. And oftentimes they don't come into a facility till they're more at a moderate stage, but there's no way of knowing how soon the disease progresses. They do have some medications that slow the symptoms, but they don't stop the progression of the disease. One is Namenda, one is Aricept, one is, and also that could be a combination. It's called Nemzaric and also Exelon. And your doctor can decide which one that they feel is the most appropriate for your loved one. It's always best to start early. Also, they have clinical trials for different medications. If if you feel that that'd be something that you or your loved one would be interested in. It's not always easy to be a guinea pig, but those are how medical advances happen with somebody that, was willing to come forward and say, I'll be part of a clinical trial. So let's see. Also, you unfortunately now, and it's always a hard subject to start, is the end of life affairs. You would have to make a decision. Again, if your loved one is able to assist in this decision making, especially in the mild stage, it's better. I think that once they know they have dementia, allow them, if it's a new diagnosis, allow them to kind of process what's happening. You've just given them terminal disease, and that might be hard to accept. So I would say first allow them to process what's happening. Give them patience, give them time to work that out where, they can kind of come to terms. There could be denial. And I think that's first. You're going to see denial, but give them a chance to just come into grips with what's happening or what's going to happen. But when the time is right, I definitely think that talking, end of life, have they assigned a power of attorney? Medical durable power of attorney, which helps to make medical decisions, end of life decisions. What, would you like a feeding tube if you stop eating? Do you want, like any type of thing? Do you want to continue with medications that could prolong your life? Everybody situation is different. Their needs and wishes are different. We should respect whatever your loved one's decisions are at that moment. Is always, try to honor that as much as possible. And if you're discussing it with them, even if you don't agree, they are trying to make decisions that, they just found out they have a disease that's going to terminate their life at some point. and they probably realize what's coming. I think that we're in a society where people do know what happens with dementia. So give them a chance to make those own decisions. If they want to be a DNR, a do not resuscitate at this time, or if they want to be what's called a full code, that if their heart stops, interventions are made to bring them back to life, just honor whatever their wishes are for their life. So those are always good. I think finding a senior lawyer would be good. Helps to kind of iron out anything that they may be, any of the financial matters in their life that they may want to get in order while they're still cognitively able to do so. Things like burial, those are the hardest things. I have people in my facility I care for now, and I was kind of auditing the charts one day, and I'm like, wow, they don't have funeral homes listed. So I thought, well, this is, it's not always an easy topic to bring up, but I would call them, and the family member, I'll say, hey, do you have a funeral? And you'd be surprised how many people have not finalized those wishes. And I always try to tell them that, and again, if your loved one is in a mild stage, for the most part, that's not something that you're going to see happen quickly. But I'm not the type of person that says, like, kind of wait till the last minute. Let's see if we can get that in order and kind of get those things taken care of sooner rather than later. There could be, for some people, maybe once they start to get a little bit more advanced, there is an issue of as far as the caregiver, can they manage their loved one at home? There are resources out there that maybe you could look into, say, an adult daycare. So it's a possibility if that you have one in your area, because if your loved one doesn't need to have permanent placement in a facility, but still maybe you as a caregiver need some time, which please take the time to care for yourself. And if you can send them to, adult daycare, even part of the time that you can have some rest, you can get out and run errands or just have some time that you're able to take care of yourself. It's very important. And I know that oftentimes people feel, well, I just need to be with my loved one, 24/7. And I totally respect and love the fact that you want to be there for your loved one, but you do need to take care of yourself. I mean, caregiver burnout is a real thing, and you don't want to have to start having your own health issues because you've put so much into your loved one, and it's just not healthy, and you should try to make sure that you're caring for yourself. If you're able to find a caregiver that can come in even just for a couple of hours, there's different agencies, I'm sure, that can provide, if you need to get out for maybe 2 hours or 3 hours, have somebody come in from a trusted agency and care for your loved one while you got out for a little bit. Again, it's very understated how important it is for a caregiver to care for themselves, to be able to recharge, go out and get fresh air, have a cup of coffee with friends, and know that, you can still go home and care for your loved one, but you're also giving yourself a little extra energy to continue with this, this daily care that your loved one needs. If you're having issues, a service like mine, and I don't know if I'm the only one in this area, this north of Houston area, if you're start to see symptoms that you don't know how to manage, that's what I do. I come in, your loved one can get a personal care plan, and we could work out whatever you're dealing with, that type of thing. You could look into if there's support groups for you. You could look maybe in the library, call the Alzheimer's Association. They may have some good resources for you as far as, it's nice to have somebody to talk to about, my loved one with dementia. And you'd probably be surprised at how many people share in the same struggles that you do. You're not alone. I mean, it's, caregiving is one of I forgot it was like $6 million worth of free care that's given by a loved one. So it is a very, it's common that people they want to keep their loved one home as long as possible. And the struggles that they face are, although everybody is unique, the similarities are the same as well. The frustrations, the maybe not understanding what's happening with your loved one, and the sadness that can occur because you realize that your loved one is sick with a disease that as of now, there's no cure. So I just wanted to share that with you today, and just kind of give you some support. There are a lot of resources. There's a lot of people in this Texas area that love seniors. I'm so proud to be meeting so many of them. So thank you so much for listening to me today. I hope I gave you some ideas and some hope for just your care of your loved one. So thank you so much for having me.
Thank you so much. I was sitting here listening, and there's so many things that you touched on that I hadn't even really thought of before.
Okay.
So while we're waiting for questions, if anyone at home has any questions, feel free to type those in the comments. Or even if you just want to say hello, tell us something that you liked about today, just type it in the comments. While we're waiting, I had a couple of questions that I was thinking about. You sort of touched on this a little bit at the beginning, but how quickly do symptoms start to appear or, I guess, become more noticeable in your loved one?
That's it's so interesting because the disease of dementia is so unique in each individual. There would be no way I could tell you how soon. I've cared for, like I said, I've been a dementia nurse, and I did spend some time with behavioral health, with brain injuries and stuff like that. But the one thing that I've noticed, and again, if I'm caring for the average of 30 people in each, and that comes and goes if somebody either passes away, and the only consistency is that there's nothing consistent about the progression. Every person is different. Even how fast, say they go from mild to moderate to severe, is so individual. It's I've had people that have come into my facility and they pass 3 months later. I've had people that I cared for 3.5 years. My own father-in-law, actually, I remember, and I want to say this was about 15 years ago. He had been diagnosed with rapidly advancing Alzheimer's, but he actually lived, I think, another 12 years, wow, which was surprising. Whether if it's possible he was misdiagnosed, I'm not sure, but, or just say he was a fighter. I don't know. that human spirit sometimes. But so I would have never have expected him to live as long as he did with the disease. So that's why there's just no way to know how fast it will progress. And that can be daunting as well, because you're like, well, how long am I going to have to, and unfortunately, I can't give an answer. I wish I could. Yeah.
And then when you do start to notice changes in your loved one as a caregiver or as someone who might be becoming a caregiver, how do you prepare for these kinds of changes?
I think mostly is education. Kind of find out, it's look up and sometimes a doctor can give you a specific diagnosis. There's vascular dementia, which is when you just don't have the proper blood flow to the brain. Now, since blood is what brings healing to the body, you get the degenerativeness in the brain because you're not getting blood flow to bring the oxygen and nutrients to the body. There's another type. It's called, Alzheimer's is the largest. Under the umbrella of dementia, Alzheimer's is the most diagnosed. And then there's Lewy body. So Lewy body sometimes resembles some Parkinson-like symptoms. You could see hallucinations. Some can be frightening. Some can be pleasant. I've taken care of a lot of people that talk about the dog in the corner or look at the children playing, and they're very happy with that hallucination. And we just let them, if it's not bringing them any type of distress. But that's often more of a, when you see that, it's like, that might be a Lewy body dementia. If they have different body movements or stiffness within the body, similar to Parkinson's, that falls under the Lewy body dementia as well. But you'll see, you'll just see different, more forgetfulness or confusion. Sometimes you'll see personality changes, especially somebody who's normally very happy and joyful could be angry a little bit more. Act out verbally a little more. So again, it's just every person's it's their own journey. That's what I say. Some people's, their dementia journey can be pleasant. They could forget, but they could just kind of ride that dementia wave, and they're pleasant, and they don't really have many issues. And others, I've seen them struggle, especially as they become more advanced. And it's hard because, you use medical interventions and different therapeutic interventions, and they don't always work. Like I said, some journeys are harder than others. Yeah. So that's sad to see. As a caregiver, for people with dementia, it's hard for me to watch them struggle with their journey sometimes. So
Yeah. Right before we started, I was telling you that, we at Care Partners, that's one of the things that we like to say is wherever you are in your journey, we want to meet you where you are and help you along,
yeah.
and give you the information because everyone's journey is so different and so unique. Um, and so we do talk about it in some of these. These are the things that you should maybe look out for, but you keep saying it's just so different in everyone.
But I think
And then
most in the, if I, sorry to interrupt, I
of
think in the
course.
beginning, what each person is like, what is not the norm for your loved one? Those are the things, so that's how you'll notice in the beginning. It's like, this is just not my loved one's normal. And that's where you'll start to see, where you look and intervene to try to get them to their primary care doctor. So.
And I was going to say, I guess we'll leave it with this last question. What self-care advice do you have for caregivers?
Whatever makes them happy. What are the things that bring them joy? Going to a book club, going out for coffee with friends, going out to eat with friends. Again, it's individual. Somebody wants to go for a bike ride, or they love to exercise or go for a walk. It's usually whatever makes that person happy, whatever brings them joy. Do those things. Continue to do those things because it does give you it's like with anything. It's like when you kind of take a step away from something that's difficult, you do something that makes you happy, and then you come back and you feel refreshed. So it really is whatever that caregiver feels is important to them. That's what they should do. So.
And I just wanted to touch on that because you mentioned it a little bit earlier. Caring for yourself is so important.
It is.
You have to care for yourself before you can care for your loved one. So that's what, just wanted to touch on that one more time, emphasize that a little bit. I guess if you just have any other last minute tips or advice.
I think, definitely utilize, there's so many people that depend, like if you're in the Houston area or outside, wherever you hear this, there are help. There's support groups. There's, like I said, the Alzheimer's Association is worldwide. Just try to educate yourself because really knowledge is power. If you understand what's happening to your loved one's brain, it will make it easier for you to manage the day-to-day. Not that it's always, but you'll kind of say, well, this is happening because my loved one has a brain injury. This is a disease that's happening into their brain. They don't want to be difficult. They don't want to forget to use the bathroom, but their brain is forgetting all of those skills that they learned from us, 2-year-old, 1-year-old, whatever it is, age that they were potty trained. And I think that the more you know about the disease, it'll be easier for you to kind of go through that journey with them. So education is very important.
Yeah.
Yeah.
All right. Well, let's see. I was trying to put this one up. Be sure to connect with Gina on Facebook. And Care Partners is also on Facebook, so you can follow both of us. Care Partners post lots of updates and helpful information. And I'm sure Gina does as well. So be sure to follow both of us. And I guess with that, we're going to close it out for the day. But thank you all so much for joining us. And thank you again, Gina, so much for being here.
Thank you.
There's so much educational things that you talked about. I love it.
Thank you.
Have a great rest of your week, and we'll see y'all soon.
Thank you so much.
Bye, everyone.
Bye.